my way. Khalifa.
Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and this is the second edition of the Live Ideas Bulletin. Our purpose is to share with you through the COVID-19 Peer Hub, to share experience, spread ideas, and take action to keep vaccination going during the pandemic. I'll be sharing the link to this website. If you have not been there, if you have not applied yet to be part of this, today you're going to get a taste of what we are actually going to be doing inside the Peer Hub. Applications are accepted until this Sunday, so do not delay. You have less than 5 days to apply. If you have not yet received the decision made with respect to your application, you will within the next few days, and certainly before Monday when we'll be kicking off activities. Just for those of you who wish to apply, know that the application process requires a bit of a thought and preparation, and I recommend that you do it from your desktop computer. So what are we doing with this Ideas Live? With me is an amazing panel of scholars who are participating, who helped build the COVID-19 Peer Hub. And two of them, Amel Altaher and Nida Ali, are going to share with us their experience, their ideas, and how they are taking action to keep vaccination going during the pandemic. Want to warmly welcome Janak Sharma from Nepal and many, many others who are connected to our Facebook live feed. Hyman from Sri Lanka, Mohammed Taimur from Pakistan, Pervez Yousaf from Islamabad, Raja Mohammed from the Mira Foundation in India. So you will see that there are people from immunization professionals from all over the world with us. So Charlotte, would you like to introduce both our guests and let us know what they're going to be sharing with us?
All right, thank you, Reda, and greetings to everyone that's joining us this evening according to Geneva time. So today we have two guests. We have Amel Atai and Dr. Nida Ali, all of them from actually working in Pakistan, and they have been actually actively involved in the COVID-19 response and the immunization relaunch in their various districts in Pakistan. So Dr. Amel Atai, she works with WHO in Pakistan, and she'll tell us in greater detail her responsibilities over there. But one thing about her story is that due to COVID-19, polio campaigns were affected. And the community felt like, okay, it was an oof from the constant relaxation from the constant door-to-door vaccination campaigns. And so they looked for ways to be able to keep the community involved and abreast with what is going on by distributing some utilities that could help them and motivate them. And so they are carrying out an immunization campaign against polio in Pakistan. And she will be telling us this afternoon, how are things going on? Have they been impacted positively or negatively by COVID-19? And then Dr. Nida Ali on her own will be telling us that in her own district province, because of COVID-19, immunization services were shut down for over 3 months. And so now they are trying to reoffer the services, and they are observing an increase in demand. So she's going to tell us how they have prepared to be able to restart immunization services and face the increase in demand or even reticence that could be observed from the community. Thank you, Reda. Over to you.
Thank you, Charlotte. So this is a teaser. We know you're short on time, so this session is going to be very short. Might leave you thirsting for additional information. You may not get all of the answers to your questions, but we know that you are, in fact, very short on time. So that is why we keep this session short. And in the Peer Hub, for those of you who join, who apply and are accepted, we'll be offering many different ways of connecting with professionals whose ideas you want to learn from. So this is not this is the beginning, but by no means the end of it. So now let's dive in. We'll start with Amel Altaher. So you work at the sub-national level. Could you tell us where you work and what you do, Amel?
Thank you, Rida. Good evening, everyone. My name is Amal. I'm from Sudan, working in Pakistan, supporting the polio program in capacity of technical officer with WHO. So since before we have been involved doing as PI staff, working in all the immunization, all the 4 strategies for the polio eradication. And now I'm based in Balochistan. The capital city is Quetta. So I'm working as office in charge for WHO office in Balochistan currently, working closely with the government and other UN agencies who are based in Balochistan, supporting COVID-19 activities. We have the first case we do have in Balochistan. It was reported on 11 March. Since that time, we have been involving all our HR in the investigation, in testing of all suspected cases.
All right, Amel, thank you. Let's step back a little. So when was the first time, can you tell me the first time you realized that this pandemic was going to affect immunization? When you said, uh-oh, there's trouble ahead. Do you remember when and where that was? What happened that triggered that realization?
That was in March. We were doing a case response in a small scope of the area in Balochistan. So I do remember the time I was monitoring the campaign in one of the area called Sibbi district. So I received that report saying that Balochistan has reported the first case. So I started, oh, okay. But I never thought that the cases will raise up. It will have that impact on our activities. Until we came the third week of March, I do remember we were sitting in the EOC here in Balochistan, the place where all the stakeholders meet and make all the decisions related to vaccination. So that was the time we start thinking, okay, now we are planning for April campaign. It was NIDs. It was planned for the whole district we do have in Balochistan, like 33 districts. Then we started fine. Now the case has been reported in one area. That was the time, along with the national staff who based in Islamabad, we start doing some risk analysis. What will be the role of our the BI staff, particularly WHO? Where are we going to utilize them? What will be the future of the vaccination itself? And Rida, let me share with you what happened. The campaign has been postponed. Even the one we were supposed to carry on the monitoring and the post campaign, also we stopped doing that in March. And since that time, there is no campaign has been carried on until we got. And
so
it was
just to step back again, Amel, I know that we're speaking with other immunization professionals, but can you bring it home? What if the campaign doesn't happen? What happens? What's the consequence? What's the negative? What's the bad thing that can happen?
Well, the bad thing it can happen, especially in this area where I'm based. We do depend on the eradication most on the SIS instead of the routine immunization. Since the COVID has the impact of not carrying out all these SIS activities, we will have immunity gap. And that is one of the big challenges we have in Balochistan.
Right. Thank you. And so what was your response? What did you do coming from that moment when you realized there was trouble ahead? And especially with what Charlotte and Boo, who prepared this live, told me is we have someone who's actually already restarted and carried out a campaign. So that is the story we'd like to hear, is how during the pandemic you may be ahead of folks colleagues in other countries in actually having gone ahead and figured out how to plan for a campaign during the COVID-19 pandemic. So can you tell us what happened and give us some specifics about what it takes to plan the campaign in this period?
Well, one of the things we were thinking initially, fine, now we are going to do the campaign because in response to the CVDBV2 case we do have in Kuwait, one of the big challenge we faced was the training, because we were keeping all the SOPs. We should not gather all the people in one place, not more than 10 participants. How we were doing the training. So what we did at the district level, we have done all the training. It was only virtual training, which it has also some impact, and we do observe some of the gaps because you cannot maintain all the people are following. Are they asking questions? Are they online? So this we faced really issues. Then coming to the UC level, I mean the house to house vaccination, their training also, it was one of our challenge, keeping those health workers in very small rooms in BHUs or health facilities. It was one of our challenge, keeping them following all putting on the protective equipment throughout the training. One of the challenge we do have, handling of vaccine itself, because it is monovalent vaccine, and we do understand. I do say that all the people who are now in peer hub, they are immunization specialists. So handling the monovalent vaccine itself, it was one of the issue. Like I have been in field since last 3 days. Even this morning, keeping all the health, the CHW, the health workers in a small room, distributing the vaccine early morning, maintaining the social distance, making sure that they are putting their mask. While they are going house to house, they should not shake hands with family, one of the challenge itself during the campaign. The fear also, we assume that the community will have fear. They will not welcome the team who will go house to house. And that happened in very small area. Like yesterday during my monitoring, I have seen three family who refused to vaccinate their children. They said, because you guys, you are bringing COVID virus into our houses.
Right. And so how were you involved in responding to that? Can you tell us what you actually, what are the words you use to reassure, clarify, and sort of respond to what may be rumors, what may be misconceptions, misinformation? Can you give us an example of what you found to be effective?
Yeah, what we have read now in Kuwait, we have constituted committees based on the reason of the refusal. The one who are refusing because of misconception, we do have committees members who are going and they do visit the houses and try to convince the refusal. Like my example yesterday. So we have tried explaining to the family that there is nothing, and those even the frontline workers, they have been even tested. We have done testing of almost like 89% of the health workers who are doing house-to-house vaccination. So we assure them that we are doing the screening early morning at the team support center before the deployment of the staff. Then we discuss with them that they have no any sign and symptoms, they are fit. And we convinced, like yesterday, I was telling them that even one of the SOPs they have to follow, they should not touch the child. So the caregiver, they have to hold the child, and the vaccinator have to vaccinate and do the finger mark. That is it.
Yeah. So we have a comment from Ebede Chinyere Blessing, a fellow professional, who says, we were in the midst of responding to an outbreak of CVDPV before the pandemic, and we were also preparing for an integrated SIA, so campaign. Everything was put on hold, she says, and currently the OBR might not continue. So that is an example. So tell us, did you consider, was it an option you considered to basically give up on the supplementary immunization activities on the campaigns, or was it a question of how you would maintain as much as you could?
Well, now what we have been discussing in last 3 days, whatever we observe in field in respect to the COVID-19 itself, we have been putting them together, because for the response, we like in our case, we cannot give up on the vaccination. We do not have other option. Yes, we do understand COVID may continue for a couple of months, but we have to carry on our vaccination because we will have other outbreaks. And already in Pakistan, we do have. for the CVDBV2, and we do have for the WBV1. So we do not have as an option other than putting all the challenges, all the issues we rectify now in round 0, and we will be working on them, looking into the training itself, looking into the community, looking again, also revising the communication activities based on the requirement in each area. But we will carry on and we will keep all these findings and we will put it as action points, and we continue for coming 2 rounds.
Thank you, Amel. So you work in Pakistan at the subnational level, and you have just told us very concretely what, yes, a little bit about what has happened and how you and your colleagues are responding. Now, for those of you who will be wanting more, I see I see lots of hellos, few questions and specific comments for Amel, but I know some of you are just joining us. So just to remind you, this is a live stream of ideas from immunization professionals from all over the world. We're doing one of these a day. You can catch the recording if you missed the beginning. That's instantly available on Facebook. And you have until Sunday to apply until the 26th of July. We may reopen applications later, but for now, applications will be closed after Sunday evening. So if you'd like to connect with other immunization practitioners, do not delay. We'll also be having a global launch event on August 3rd. So this will all be online. And everything about this, you're going to see this session will end at the half-hour mark because we know that you are short on time. So with that said, let's go to our second guest. So Nida Ali is from Pakistan. She has worked at many different levels of the health system, I believe. And can you tell us, Nida, what happened when the first case of COVID-19 was reported in Islamabad on the 26th of February? What was the observation that led you to take action? Oh, and I'll have to unmute you. Yes, sorry about that. Yes.
So the thing is that we were preparing for this pandemic way before the first case hit Pakistan. For preparedness, we were doing the usual things like risk forecasting, capacity assessment, contingency planning, and stockpiling of logistics, training health professionals. We were doing all that. But once the case emerged, we realized no matter how much we prepare for it, we are not prepared enough. So we had done our risk forecasting and we had taken a few measures to mitigate the risk, but still it was a pandemic. So nobody can fight this alone. So our government was smart enough to, build strong partnerships in a small amount of time. And it was this partnership that that helped us to be able to, control this pandemic. And we are at a point now where we are observing decline in number of cases for the past couple of weeks. And we are hoping to flatten the curve now. Yeah.
So let's go back to February. You realized that there's no trained staff for management and response, that data management was fragmented, that coordination among various stakeholders was lacking. So what did you do in response to that? And can we get specific about how you did it? What was different because it was a pandemic? There's in immunization, there's ongoing training in management, response data, including data management. What was different? Was it the urgency? Was it the methods you used? Was it tell us more.
So the thing was that it was a pandemic, and like every other country in the world, we were dealing with this for the very first time. So although we were preparing for it, but we were not prepared enough when this pandemic hit and the cases started to rise like anything. So we were unable to, streamline things because there was no health professional who was already trained for Corona. There was no health professional who had seen anything like this pandemic ever, like apart from a few people who had already worked for SARI and SARS and MERS. Apart from them, there was very limited experience and very limited technical knowledge of SARS-CoV-2. So and the issue with data management, because there were so many stakeholders involved in form of so many partners. So data sharing and coordination and communication was a little bit tough between government and partner agencies. But we finally managed to bring it all together as a public-private partnership, and now it's in a much better shape. So it was, gradual. It didn't happen overnight. We had to sit in the offices where people were reluctant to share data. We had to, work overnight and keep calling them and trying to build liaison with them. So finally, it started, rapport building and trust building. And in that way, very slowly and gradually, we came on one page and we started sharing the data and integrating the data. Now we have one platform in Pakistan, which is called IDIMS. It's short for Integrated Disease Management Information System. Now, all the data from every corner of the country is coming on this one single platform. So whatever we want to know about COVID, even the specific case details, we can have this on this one single platform.
All right, thanks. I want to point to a comment from Ibrahim Kamara, who says, for us in Sierra Leone, we should have introduced a new vaccine, which is HPV, but due to the pandemic, that new vaccine introduction has been postponed to next year. However, routine immunization, he says, is ongoing in his district, having done a robust community engagement and social mobilization. And this is familiar. So the challenge is yes, but also what we're hearing consistently within the peer hub is such as whether it's Nida or Amel or other immunization professionals really adapting and figuring out how to adapt to this to the changing conditions imposed by the pandemic. So you said it sounds like initially your role on behalf of the World Health Organization, that there's an issue with coordination within the country. Those issues are also fairly common between and how organizations work together and how partners work together in immunization. What was different this time? And can you tell us about a conversation you had where someone who was initially reluctant to coordinate, to focus on the issues that you were trying to bring attention to, sort of came around and said, "Yes, you're right. We have to do this, and let's move forward together." I think that may be an important story to hear.
Yeah, all right. So initially, there was only one national lab that was doing testing for corona, which is NIH, National Institute of Health, Islamabad. So I was placed there as a focal person to coordinate between lab and National Emergency Operations Center. So when I got there and sat down with people at NIH, they were very reluctant to share data with me. I saw that sheet of that spreadsheet where every case was listed, every tested case was listed, whether it's positive or negative, and I asked that person to give me that sheet so that I can analyze that and I can prioritize the areas of work according to that. But that guy from government, he actually said to me that, no, I cannot share this data from you. This is highly confidential and you're from WHO. So, we cannot share this with you. This was his comment on day one. And now, after 3 months, there was this whole working together, fighting and, long phone calls and working, fighting back and forth in meetings. It was all of that. And now we are at a point where he needed support because his father was COVID positive and in ICU. So he asked me to work in his place until his father recovers. So from the point of not sharing data to the point where he's asking me for help. So this was kind of a small success story where we finally managed to build enough coordination and to work towards the single goal.
Great. Thank you so much, Nida. That's powerful testimony. And I imagine my sense is that we've got over 100 people who are connected on Facebook listening to you. And I'm betting that many of them have had these kinds of difficult, perhaps courageous conversations, as some might call them, with their peers saying this is unprecedented and how we're going to do it, how we're going to respond might not look like what we have done in the past. Or Dauda Garba Saidu, I've had the comment up on the screen for a little while. So we have many participants and applicants from Nigeria in the Peer Hub. We've seen many messages from familiar names and also new ones as well. So Dauda says, social distancing is a challenge in my environment in Yobe State, Nigeria, during vaccination and immunization sessions. Bearing in mind the culture where we're coming from, continuous community mobilization and sensitization might enhance the awareness. And I really we've heard from Amel about that dimension, and from Nida, the coordination, between partners, and the kinds of the kind of dialogue and awareness and sort of willingness to move forward that is required to get there. So I want to greet a few more of the individuals. Again, we're seeing many hellos. Pervez Yousaf says a good presentation. Nida. Olofunmilola Adegbite from Nigeria is with us. So is Ismaila Edego, who says interesting session. Abdul Sami Khan. So Abdul, you haven't told us where you're from or what context you're referring to, but you say limited data sharing is the initial challenge. So I think that will sound familiar. So what you for a immunization professional who is working now, Nida, at the same level or at the in terms of planning and coordination, working with partners, what would be your advice? What would be the most important lesson learned from this work that you have done? Figuring out how to build shared purpose against this pandemic to maintain immunization services and fight the pandemic itself.
First of all, there's no single endeavor that can be successful without strong partnerships. So partnership is an answer, especially in case of pandemic. I mean, no developed country can fight it alone. And similarly, in my context, from a developing country, we cannot fight this alone. So we brought together all the resources of other programs, immunization programs, into fighting COVID. For example, I was talking to Charlotte earlier, and I told her that immunization services were suspended for over 3 months in Islamabad, where I'm from. And during these 3 months, our vaccinators were actively involved in corona field activities for tracing case contacts. And 3 of them, they got COVID positive, and 1 of them actually died. We lost one of our very experienced vaccinator during that. Now we have resumed our vaccination activities from July 1st, and we are seeing increase in demand of vaccines because there is a large cohort of children, especially those who were born during these 3 months. They are still 0 dose. They haven't received their first vaccine yet. So our lesson is to, build strong partnerships and maintain all-time preparedness status to fight anything like that. I mean, I think this pandemic was a wake-up call for everybody. Even good health systems failed to cope up with this. So what we have to do is we need to invest more into healthcare now, and use whatever the strong tool is there at any country's disposal. For example, we had a very strong partner at our end in form of Pakistan Army. And I was talking to one of my Japanese colleagues, and he said, we do not have a military, so what do we do? I said that you have the strongest tool at your disposal, and that is how technologically advanced Japan is. So you use that and find some innovative solutions. And our military was a very strong partner, and they came up with this initiative of TTQ, that is trace, test, and quarantine. Now they brought this novel idea in case of this novel disease, and we were able to, identify so many positive COVID cases through this mechanism. So yeah, that's all.
Thank you so much, Dr. Nida Ali and Dr. Amel. Both of you from Pakistan today, but there will be many voices from many different countries. Over 90 countries are represented in the COVID-19 Peer Hub. So whether you are still waiting to hear, to receive the letter informing you of the decision, whether or not you are admitted to the Peer Hub, or whether you have already received your letter of acceptance, I want to thank you for joining us. And there will be many, many occasions on which we will invite, we'll be sharing experience with the broader immunization community. So we will not be, we'll be having, and I would like to, let's see, we have actually 113 people connected to the live stream. I'd like to challenge you. Right now we have 71 thumbs up and 45 hearts on Facebook. And I'd like to know if you feel that, if you feel that we should have more such live events in which we invite immunization professionals to share experience, could you add a heart and a thumbs up? That way we will know that you are actually interested in coming back for more such events. So go to the, I'm assuming most of you are familiar with how Facebook works. Yes, please add either a heart or a thumbs up or both, depending on how you're feeling about this this session. We have 117 people connected, so please, do not be shy or or stingy with your hearts or your thumbs up. Okay, all right, you've surpassed my expectations. We're seeing Thank you. And I'd like to ask you to, if you haven't done it yet, add a heart for our presenters today. I see one, okay, 102, 105, 107. All right. Okay, so it's funny because we would love to hear your actual voices, which we can do in the Zoom room, but we've actually chosen to focus on Facebook because it's so much more immediate and interactive in these different ways. Thank you, Hachafana, who says busy sending heart and thumbs up. Jiking Lumba says the session is the best because we got a live experience sharing. That's absolutely the point. Many of you have shared great comments, very detailed comments describing your situation. So I invite all of you who've listened to the broadcast to actually take the time to read through them and see okay, we're up to 165 hearts and 241 thumbs up. Can we bring the hearts up to the same level as the thumbs up? I think there is love amongst immunization professionals, love and passion for keeping vaccination going and saving the lives of children from vaccine preventable diseases. One reminder, currently COVID-19, of course, is not, there is no vaccine currently for COVID-19 that has been proven to be safe and effective. So let there not be any confusion. We're talking about the impact of the pandemic on immunization services. So that's it for today. If you'd like more of this, I encourage you to apply. If you haven't already, you'll be receiving. If you have, you'll soon be receiving the letter informing you of our decision. And please, if you keep following us on Facebook, you will see more experience sharing, more ideas being shared than we hope you ever have before, and you'll find the ones that can be useful to you. Thank you so much for being with us today. Thank you to our guests, Amel and Nida, both from Pakistan today. And Charlotte, we're over time, but you want to tell us who will be coming tomorrow for the for the third Live Ideas Bulletin?
Thank you. I'd rather keep it a surprise, but let me just say they will be coming from Timor-Leste and Nigeria. But we'll be having special guests from the Sebine Institute tomorrow for tomorrow's session. Thank you, Reda.
Okay, wonderful. And we need you to share with your colleagues. If you think this is 30 minutes well spent, this is useful and interesting to you, please share with colleagues. That is one of the best ways, one of the most powerful ways that you can help us. Wishing you all well. Thanking you for being here with us. Thanking all of the scholars who contributed to this, and especially Charlotte, who actually did the legwork, yes, and the groundwork for this session. Thank you, and see you soon on the COVID-19 Peer Hub to share experience, spread ideas, and take action to keep vaccination going during the pandemic. Thank you and goodbye.
Bye.